things that can put a pregnant woman at the risk of having baby with this kind of condition. This condition is called omphalocele. Okay, this is where the baby's intestines and other internal organs protrude outside the abdomen via the belly button. Okay, there are some certain things a pregnant woman could do or could take that can result to this. However, most times the cause to this is unknown. Number one risk factor is alcohol. As a pregnant woman, you're consuming alcohol, you risk having a baby with this kind of condition. Know that no amount of alcohol is safe during pregnancy, okay? You do not know if it is that little quantity that can cause you problem in that pregnancy. So it is better you avoid it completely. Number two is smoking. As a pregnant woman, you are smoking. You put your baby at the risk of having this condition. Number three, it's genetics. Okay, what I mean by it runs, sometimes it can run in the family. If it runs in the family, then it's possible to happen. Number four is some maternal condition, like a woman who is diabetic, an obese woman, a woman who has hypertension. Okay, now if you are obese, it is important you work on your weight and maintain a healthy weight. And if you're diabetic as a woman, as a pregnant woman, try and monitor your blood glucose level, okay, and put it at a normal level, okay? And if you're hypertensive, also monitor and control your blood pressure, because if you do not put all these things in control, you risk having a baby with this kind of condition. Number four is some certain food. When you are not feeding well as a pregnant woman, that is, you lack the essential nutrients and vitamins, you could put your baby at the risk of having this kind of condition. Number five is taking some certain medication during pregnancy that is not prescribed by your doctor. And number six is exposure to some chemicals and some toxins, example, pesticide, okay? So if you are consistently exposed to some chemicals and toxins, you risk having a baby with this kind of condition. So hole in the heart is a congenital heart defect that most babies are born with. As a pregnant woman, there are some certain things you could do or you could take during your pregnancy that could put your baby at the risk of having a hole in the heart. Number one is alcohol. As a pregnant woman, you are consuming alcohol. Some of you even take beer. Please, you risk having a baby with a hole in the heart if you don't stop it. Number two is taking medications that are not prescribed by your doctors, especially painkillers. You are putting your baby at the risk of having heart problem. Number three is taking herbal concoctions. They will mix herbal concoctions for you. Whatever it is reason you're taking it for. You risk having a baby with a hole in the heart. Number four is on certain maternal conditions, like a pregnant woman that has measles, German measles. Your baby is at risk of having a hole in the heart. A diabetic mother also, if that diabetes is not controlled, it can affect your baby. If your blood pressure is high as well, and if it is not controlled, it can also affect your baby's heart. Okay, so the next one is smoking. As a pregnant woman, you are smoking. You risk having a baby with a hole in the heart. So if you do not want to give birth to a baby with a hole in the heart, and you know as a pregnant woman you are doing any of these things, please avoid it. Avoid them. And as a pregnant woman, if you notice anybody that has measles, shift from that place. Do not take any medication without the prescription of your doctor. Don't go ahead and be abusing painkillers. Paracetamol is not a routine drug. It is only taken when necessary, and it should be taken only when your doctor asks you to take it. Okay, bye.